As an educated meathead, I want to be doing everything I can to recover from each training session. Rapid reboot compression therapy is one of the tools in my tool belt that I not only use in just my office, but myself after every single leg session, and it really makes a difference. Use my promo code Dr. Marvin Says to save money on any of the compression systems. That is definitely Dr. Marv approved.
Today, we're going to rate our favorite training exercises for each muscle group with a rating system we call Smash, Marry, Pass. Smash means we just can't do without it. Marry means we're committed to it for the long haul. And pass means we don't want anything to do with it, even if it's standing in front of us naked. Don't go anywhere. It's time for Between Two Dumbbells.
Yo.
I'm your host, Skip Hill, and I'm bringing over 40 years of bodybuilding experience to the table, including over 24 years of online coaching. I'm joined today, as usual, by my co-host, Dr. Marv, a.k.a. the Educated Meathead. Ladies and gentlemen of the audio radiance, you're Between Two Dumbbells.
What?
I know, right? Today we're gonna play a game. Smash, Marry, Pass. Marry, to be clear, is M-A-R-R-Y. It's not the name Mary. I was struggling with that. We have a list of 3 exercises for each muscle group that we will both rate using the Smash, Marry, Pass. But to be clear, I'm going to lay it out for you. Smash means that you will hit it, whether it's good for you or not. Marry means you're committed to it, whether it's boring or not, because it works. And pass means you do not want to hit it, even if it's standing in front of you naked. Did I cover it or what?
That was excellent.
I felt pretty good about that one, actually.
Yeah. Well, folks don't know, I had to explain the whole concept of the F, marry, and then unalive. And so
Right.
Skip was like, what in the hell are you talking about? Like, what? So there's our little generation gap.
Yeah. It's our version of FMK. We'll call it, we'll use the acronym
there we go.
FMK.
Perfect.
Yeah.
Yes. Yep. So hopefully we can start a new trend and make it more PC to be able to talk about this openly on YouTube without getting shut down and reported to the CIA.
Exactly. The CIA. and Smash, Marry, Pass has the smash and pass in there.
Yep.
So we're
perfect. We're adding one
staying
word.
on it.
One word.
We got a good list. You came up with the list. I give you all the credit. I came up with another list and I'm like, yeah, this isn't going to work. I think I'm misunderstanding what he's talking about. So what do we want to start with? Run with it. Back rows?
Okay. Yeah. I'll start with category of back rows, because I also have back pulls, as in a vertical pull versus a horizontal row.
Okay, cool. All right. Now who's going to take it first? We gotta.
Yeah. I'll say this first one.
Okay.
We've got to choose between a barbell row, so a bent over barbell row, a T-bar row, or a one-arm dumbbell row.
Okay. And I give my smash, marry, pass.
Mm-hmm.
I am going to smash the T-bar row. I'm going to marry the barbell row. And I'm going to pass on the one-arm dumbbell row because I can see it doing one side at a time. It's not that it's a bad exercise, but nonetheless, I'm going to pass on that one. What say you?
So I'm marrying one-arm dumbbell rows, one of my favorite exercises of all time, also one of the greatest core exercises of all time, if you do it right. I am passing on a bent over barbell row, largely because when I broke my back when I was younger, it healed, shifted forward because nobody believed me. They just said it was growing pains. So being bent over in that position, I'm very intolerant. And then I will smash a T-bar row, but I have to be very careful when I do those.
I think we could, if we wanted to, be able to say what the other one, we could almost rate each other's, and I'll bet we'd be 98% right. What do you want? Because I was like, this is what he's going to say. Yeah. I figured that dumbbell row would be up there. So for
I love them. I love them.
Yeah, and I like them when I do them both at the same time. But you specifically said one arm. So I'm like,
I threw that in there on purpose, and I knew you were going to pass on that because of that.
Anybody who knows me goes, Skip's not going for the one arm version. No, left, right, left, right, left, right. I'll do that. I'll hold dumbbells and alternate, but I won't do one side at a time unless I have to. So for the back pulls, I'll give it to you first then. lat pull down, pull over. I did it back, but anyway, lat pull down, pull over, pull up.
Okay. Ooh. Oh, those are all good. I will marry the lat pull down. I almost said the K word. Pass
I
on
know,
the
right?
pull over only because of my shoulder, and then smash the pull up. Now, if I
Okay.
didn't have shoulder issues, I would definitely be smashing a pullover, because I do think doing that isolation-esque movement for, the lat and teres, I do think it adds something that you can't get with rows to a small extent. I really like them as like an opener, stretching things out. Also, it's a great way to work on flexibility and making sure you're getting what I always talk about, upward rotation of the shoulder blade. So
Right.
there's rehab into it. But with shoulder limitations, I'm going to have to sadly pass on the pullover.
This is going to be cool because we're not going to agree on any of these, which is
Finally, we
good.
finally found a
Yeah,
way to disagree. Yeah.
exactly. It only took us, what, 10 months?
Yeah.
Okay. I am going to smash the pull up. I am a
Mm-hmm.
big fan of chins. I call them chins, but whatever.
Okay.
It's the same thing. But I will always take chins over lat pull down. I'm not a big fan of lat pull downs. So I'm gonna, because I've already given that away, I'm gonna say I'm gonna definitely pass on the lat pull down. Just not a big fan. It's never been a very good. I can use the variations, but the
Mm-hmm.
traditional lat pull down, just not a big fan of. But I will marry the pullovers. I love them. They arguably work better for width around the shoulder blade for me because I'm narrow clavicle,
Mm-hmm.
narrow, shouldered, and my scapula don't like to open up. It really gives me, and I use it as a finisher. I like that stretch at the end, and I don't go
Mm.
heavy. I'm not one of those guys who's going to pull, and I kind of cringe when I see this, if I'm being honest. If you're I'm not saying don't use a pullover as a mass exercise. It's not what I'm saying. But it's so easy to move more weight at the expense of mechanics. And
Mm-hmm.
one of the things that I want to add with this real quick, and I know we can't get too deep into these because we want to cover a lot of them, but what I call push up and away when I'm in the extended position. I have very little bend. I arguably have a little bit more bend in the top position when it's over my chest. And I like them on a decline. I know we didn't specify, but I do. I
Mm-hmm.
push that dumbbell over and I don't force the stretch, which I think I should add as well. I want to stretch, but I'm not going to force it and put my shoulders in a crappy position.
Didn't we do a whole episode on pullovers?
We did.
It's
And
ringing a
for some
bell.
reason it
Yeah.
didn't do very well. And we did it at the very start of when we started the
Yeah. It
podcast,
was when we were
but it
figuring
was
things
good.
out.
So
Yeah.
anybody who wants us to
Mm-hmm.
do the deep dive into the pullover, look at that, watch that show
Mm-hmm.
because I think it's solid.
And we talked about how, like, there'll people will be doing a straight bar with 3 plates aside doing
Yeah.
pullovers. I'm like, good God. Like, job security. So thank you. Keep doing
Yeah,
that.
it ends
But
up being a tricep movement
yep.
equally as much as back, if not more.
Mm-hmm.
And of
Yep.
course, we could get into the argument about chest and versus back, but that's
Mm-hmm.
in the
So
show. So check it out. Just
tune
don't grade
into
us on
that
our
episode.
presentation at that point because it was
Yeah.
very early on. You'll be
Yeah.
like, wow,
Right.
they've come a long
Somebody
way.
did comment, man, because they watched the first episode. They did comment, wow, you guys have come so far since then. So I
That's
was
good.
like,
I'll
I
take that.
agree, which is
I'll
good.
take that.
You
Sure.
better. Yep. Yep.
Yeah, if it's the same, we got a lot
Yep.
going wrong.
Okay, so we got shoulder raises,
Mhm.
dumbbell lateral, cable lateral, or machine lateral.
Cool. Do I take it first?
Yep.
This one is super easy. Don't even have to give it much thought. I am going to go with the cable first. I have a little bit of a bad
as your
lab. Yeah, I got to be
smash or
careful. You're
marry.
right. I got to use the
Yeah.
right terminology.
Yeah.
Cable lateral raise, I'm going to smash. It is, I have a little bit of a torn, irritated labrum. I had it for 30 years of the 41 years I've trained. Cables, they just allow me to not irritate it. There's no issue there. And my delts blow up. Dumbbell laterals every now and then, great. But anyway, the dumbbell lateral raise I'm going to marry, which is difficult for me to say. for that reason. But every now and then it works really well. I can't do them frequently or it just becomes irritated. And the machine lateral raise, I'm going to double pass on because it never feels right. I've tried so many different variations of it. It just does not work well for me. Definitely a pass.
Okay. Um, man. See, and that's why I purposely made it this hard because they're all legit exercises.
Oh, yeah, absolutely.
It's not like some nonsense.
Yeah.
I will marry the cable because that's my favorite, especially a wrist cuff. Oh, good God. I will smash a machine and have a hard time saying this, but pass a dumbbell lateral raise, even though I did a lot of dumbbell lateral raises, especially earlier on. But
Yeah.
remember, I look at dumbbells and my delts grow.
Right. All right. Shoulder press. This one will be good too. Machine press. Overhead, obviously. Barbell press overhead. Dumbbell overhead press. Now, can I just at least be clear on, is the barbell press a front military press or is it a behind the neck press?
You get to choose, and I know
Oh,
what your
okay.
answer is going to be. That's why I left it
By
kind of
clarifying.
vague. Yeah, because like 90% of people should not be doing behind the neck presses,
Right.
which once again, I think that might have been our very first episode. So if you
There-
want to see what
yeah.
that other viewer said,
We're just plugging
go
the hell out
look.
of the old shows.
Yep. 100%. I mean,
Yep.
come on now.
Got to get them to watch them. The early
Yep.
shows. All right. How are you ranking it?
So you got to go first.
Oh, okay. I will.
Or no. I'm sorry. I got to go
I
first.
say I read
Sorry.
them. Go ahead. Yeah, you take it.
Yep. Passing on the barbell, I haven't been able to, which I used to love doing standing military presses. I'm stronger pressing overhead than I am pressing horizontally. So that was an ego move for me. I will, oh God, man. See, I can't do dumbbells or barbells. It's so sad.
It makes it hard. Yeah.
Yeah. So obviously smash, marry, wife up, buy a condo for a machine press, right? And then pass on the barbell and I guess I would know. I guess I would smash the dumbbell because the dumbbell's not good for me, but I would have to, right? And marry the machine.
Okay.
Yep. Marry the machine, pass on the barbell, smash the dumbbell, and just know my shoulder's going to hurt like hell.
Fair enough. Okay. I am going to smash the barbell press, but I'm going to say to the front, military.
Really?
I know, but
Wow.
I'll explain why. But I'm gonna go with the barbell press first. Then I'm going to marry the machine press because it is my go-to because I absolutely know that it will not bother my shoulders at all or my shoulder, and I typically use a neutral grip on it. And I prefer a machine that'll go up and back, but that's just preference.
Okay.
And I'm going to actually pass on the dumbbell overhead press, even though it works really well. It's getting the dumbbells into position that is, if I had a training partner who could hand me the dumbbell, great. But when the dumbbells get really heavy, I start doing very unorthodox things to get them into place. I typically will stand in front of the seat, do a double swing, and flip them kind of, what is that? Clean. I'm not very good with the powerlifting movements, if I'm being honest. They're the Olympic lifting movements, but I'll clean them and then I sit down. Then I have to get them, rotate them and get them into position. It's just a very laborious task that isn't great on my shoulder. So that's why. But I will say this. Here's my caveat to the barbell press. If that were the behind the neck press, I would have put it above the shoulder raises because I consider that a side delt movement. So in this shoulder press, they're kind of front delt exercise. So I wanted to stay focused on that. That's why I say that. Yeah.
And then they now have things where for like garage gym folks, you put little hooks on a barbell where the dumbbells are there.
I've seen that.
Yeah.
My
So that
problem
might
is the
be
gyms
worth
I
looking
train
into.
in, the ceilings are way too high and they're not going to like me modifying their
No.
setup. by bringing in hook. But I see what
They're
you're saying.
so no, the company came out with where you put a barbell and you put clips and then you're able to rack your dumbbells on it so you
Oh.
could sit there, unrack it, in press. Hopefully me talking
Oh,
about it, Instagram will show it on my phone. So
I know what you're talking about.
dumbbell
Yeah.
assist, dumbbell assist, dumbbell assist. Hopefully
Yeah.
my phone's
Putting them
listening.
down is not an issue, but getting
Because
them into
then you just,
place.
yep.
Yeah,
Correct.
that's a
Yep.
that's a very good point.
Yep.
Man.
I have my
I've
moments, few and far between.
I've seen them, and I did not put that together for that exercise. I'll be damned. 'Cause they have they have the assisted machines that are levers
Yep.
that you stack, the
Yep.
dumbbells, which is
Which are
great. I mean,
awesome.
they're
Yes.
great for dumbbell press,
Mhm.
flat dumbbell press, incline, and they do have them for shoulders, but good luck finding them. They're only in very
Hardcore.
few gyms.
Hardcore
Yeah.
gyms.
Yeah.
Yeah.
What's the next one?
Chest pressing, dumbbell press, Smith machine press, or a machine press. I didn't
Okay,
do free barbell because we both were going to say absolutely not.
yeah, exactly.
Yeah.
Can the machine press be a hammer?
Mm-hmm.
Oh, okay.
Mm-hmm.
Then this is another easy, very easy. Give me the hammer wide decline all day long. I will smash it. I will wreck it. I could say there's one more thing that would be really funny, but someone would find it offensive, so I'm just going to stop there. I marry the dumbbell press because it's just that exercise that will never do me wrong. I'm good with slight decline, prefer it that way, but nonetheless, dumbbell press. And then the Smith machine, I don't think I've done Smith presses or flat, or not even just flat, but any barbell press in a very long time. I'm still okay with finishing with them on occasion, but I still haven't done that because it's just I'm not feeling it. I'm talking probably at least probably 3 or 4 years have I touched a barbell for a press.
Okay, yeah, and we did a whole episode on why we feel that way about the bench press, so
Right.
more homework for the listeners.
That's right.
I will marry the machine press because that's essentially what I've been doing for the last 2 years.
And you like the
Um,
same wide decline that I do, right?
I do, yeah.
Yeah.
That's one of my favorites. Decline hammer, the ISO lateral wide, and then there's a really good Cybex plate loaded, or pin loaded one at one of the gyms I train at during the week. And I exclusively did that for over a year, and my chest got the best it ever was, which again, I'm not hitting the different angles. It shouldn't happen, but it did.
Right.
So that's really has me existential crisis mode. I will smash a dumbbell. I had given up on him since 2021. I was able to do 2 workouts with them with the shoulder post stem cells. Shoulders a little flared up, so they're pulled out of the rotation again. And then I will pass on a Smith press. When my shoulder can't allow it, though, a guillotine Smith press at the end of your workout is perfection.
Yeah.
But it's got to be really respected. It is a vulnerable position, so it is a finisher, just like a flat barbell would be. But that grew my upper chest more than anything ever has.
All right. Hamstrings, seated leg curl, lying leg curl, RDL.
I purposely didn't do the standing one leg curl because we both agree that is trash and
Throw it
should
in there.
never even be
That's an
considered.
easy
Yep.
one.
So I made it harder. So I will marry a seated leg curl, smash an RDL, and pass on the lying leg curl, which I know we're going to disagree on.
But I will say this, I have changed my my stance on these 3 exercises a little bit over just this last year.
I
I know,
convinced
right?
you slightly. Yes, like 5%,
You did.
5%.
And more so.
Yes.
Yeah, you did
Wow.
impact me, and I took
Dang.
a closer look at them. So here's what I'll do. I will do I will smash the correct seated leg curl. By correct, I mean I don't like the hammer seated leg curl because the resistance is so minimal in the stretched position. And I feel that the backrest is too inclined. If it had me up a little higher or a little bit more straight up, okay, cool. But I feel like it's too inclined.
Mhm.
So I am going to smash the seated leg curl. Here's the part that is going to really make me want to high five you and you me is the RDL used to be a big pass, but I have been
Uh-huh.
doing them more consistently and I do like them. I will always do a curl version first. Yeah, I
Okay.
consider an RDL for me a little bit more of a finisher, but then I will go with the lying leg curl. And I arguably like the feel of the lying leg curl better than the seated, but I am getting better progress or better benefit out of the seated as long as it is not the hammer. And
Mhm.
really, the big takeaway from our discussion about that earlier in the year was I just went away from the hammer strength seated leg curl and went with the
Yeah.
machine. And when I did that, there was a very big difference.
Yeah, nothing's like, equipment manufacturer gets everything right. That's one of the bigger misses from
Yeah,
Hammer. Normally, they're amazing, but
yeah,
yeah,
I
not
agree.
good. Yep. And then, like, I said it on the seated leg curl episode, people who make a seated leg curl without a proper lap pad for you to brace and anchor in, they surely order their filet mignons well done with a side of ketchup. Like, way to take something awesome and just ruin it.
Yeah.
Doesn't make any sense. Okay. Uh, Quads, but it's going to be machines for quads. Leg press, pendulum squat, hack squat.
Okay. My favorite is not in there, but that's okay. I'm gonna smash a pendulum all day. That's my I
Okay.
I big on that. Hack squat, second, and this has a lot to do with safety or risk ratio for me because of my long history of lower back issues. Even though I'm not injured now and haven't been for almost 10 years,
Mhm.
I want to keep it that way. So pendulum smash, hack squat, Mary, as I'm always good with that. The leg press has to be a pass for me, not because it doesn't hit my legs well, but because that is easily the highest risk for my lower back of any of those. I can't remember the last time I did a leg press. I'm to the point where I refuse. I would rather back squat with a barbell, a free weight barbell, than I
Whoa.
would, yeah, than I
Okay.
would the leg
Yeah.
press.
All right.
It's that hip turn, it's that
Yep.
SI issue there that does not work for me. I can handle the compression of a regular squat. I don't do them a lot because it's still a vulnerability, but the leg press, if I had to pick between a barbell squat, even though it's not an option, and a leg press, I would actually barbell squat eh, with very not a lot of worry, but a leg press, literally to put 2 plates on a leg press, I would be scared to death.
Okay.
Yeah.
Yeah. I did a lot of leg presses early on and I've kind of gotten away from them. No reason, just, but like leg press widowmakers, oh, the best part of my week. So I will pass on a leg press now just because I don't do a lot of it. Smash the hack. Um, it pisses my knee off, but God, that blew up my legs more than anything. And then I'll marry the pendulum because that's the safest, right? It's the
Yeah.
least amount of loading, the best biomechanics. Um, so yeah.
Yeah. Unilateral quad movements. I like where you're going with this. I like how you
Hmm.
split up the back. I like how you're splitting up the quads. Bulgarian split squat, lunge, single leg press.
Because I was gonna go B stance squat, but I know you haven't done those maybe ever. So I was like, let's do one that you might
Right.
want,
Yeah.
right? Sadly, I have to pass on a split squat. God, if I could get my knee to get me to do split squats again, I would be the happiest man alive. I'm one of those psychopaths who absolutely love them, especially John Meadows' drop set of death that I made harder because I had two dumbbells, not a hand to balance, and I did 10 reps. And I worked up to starting with the 120s and then 100s, 80s, and 60s. I would do one all out set, and that was it for quads. Like, it
Okay.
was god awful.
Mhm.
The worst part was doing one leg and then realizing after I caught wind for 5 minutes, I had to do the other
Yeah.
leg.
Exactly.
So I sadly got a pass, but man, like if you could do a split squat, it is awesome prehab. But if you have a flared up SI joint or a flared up knee, they are doom. Like they're
Yeah.
doomsday for that. So yep. I will. Performance chiropractic and sports medicine in the Houston Bay Area, telemedicine and nutrition coaching all over Texas. And if you're not in Texas, don't worry. You still do consults through the educatedmeathead.com. Where you also find workout programs, seminar recordings, and online courses. Smash a lunge. I'm really taking this from Dr. Danny, of finishing leg days with walking lunges to get that unilateral to restore some of the natural rotation. And then I will smash a single leg press. Don't do a lot of them. Just, it's been a while, but there was a period of time where, man, doing like Dr. Scott Stevenson's muscle round and a single leg press, awesome, torture, amazing.
Fair enough. Okay, easy one. Single leg press with the caveat that the platform is split because
So you could
again,
alternate. Yeah.
left, right. I'm not gonna let one leg dangle and do one
Yep.
side at a time.
Okay.
And they're difficult to find, but
Mm-hmm.
when I find them, they're gold. That is an easy smash for me. Lunge, gonna marry it. It's always been good to me. Again, as a finisher, I don't think I've ever, if I have, it's been a very, very long time because I can't remember it. I don't think I've ever used that movement for anything other than a finisher. So I just happened to be right and then found out years later from Danny and people like that, that it's a good finisher.
Yeah.
And then of course the Bulgarian split squat, I pass on. I think I've only done them 3 times in my life.
Okay.
They don't feel good. They're very awkward. It could be a flexibility issue across my hip with the rec fem. I don't really
Mm-hmm.
know. I'm not sure, but it's just not. I find myself with a lunge. I can leave the back leg out of it. Is it more so like it's just back there? I consider it dead. Obviously, I'm using it for balance, but I am. I will never push off with that back foot. I don't use the back leg. So the lunges are just they're just so much better. They just feel so much better. And that's why I've stayed. I'm like, I literally thought I have the lunge. What the hell do I need a Bulgarian split squat for? I'm
Mm-hmm.
good with the lunge. That's really how I look at
All right. Tricep isolation. We got press downs, skull crushers, or a French or overhead press.
it. Okay, but the French press, just so that I understand, we're talking about essentially an easy bar
Could be
extension, right?
cable, could be dumbbells,
Oh, okay.
could be
Okay.
easy bar. Yep. So I'm letting you choose, and obviously we want the listeners to be chiming in of what is your list, right? So make sure you're chiming in down below. But I'll leave it open to whatever implement you want.
Okay. Number 1, the smash is easy. An overhead extension, essentially the French press, even though
Mhm.
I prefer a dumbbell version versus the easy bar in that position. Primarily because there's so much long head involvement. I've been a stickler about that for years. I want the bulk of my tricep work to be long
Amen.
head focused. The press downs I have to marry that because I don't think that I have done a tricep workout without opening with some version of a press down for at least 10 years. It's just a like a safety mechanism for me. It's
Mm,
warming, getting the triceps,
mm.
getting plenty of blood in there, getting the pump, getting everything ready to go so that my elbows aren't irritated, and it just works beautifully. So I have to marry that. Even though I don't find the exercise or use the exercise as a mass builder, if you will, or something that I am looking to continuously, progressively overload, that sort of thing. It's an opener for me. And skull crushers, I hate to pass on him, but given the 3 options, I would throw that one in the trash and pass on that one before the other 2. I could do without them,
Come.
but I do like them.
Hmm. I actually did blood flow restriction skull crushers yesterday, which is the third time doing that, which is a big deal. But I will still pass because of elbow issues. They were great for me when I was younger. Like I got really strong. Like
Same here.
the equivalent of dust. If you put my body weight compared to the weight I was using, It was close to like Dusty's just freak of nature
Oh,
numbers,
okay.
right? If you
All
do
right.
body weight to weight.
Or Justin
Um,
Harris.
yep, correct. Yeah.
Yeah.
I just they're just raw dogging a straight bar in their
Yeah. And
late
I would
40s,
love
early
wouldn't you just
50s. I'm
love to
like, good
do that?
God. Yeah.
I
I'm
mean, I
like,
guess you did
man.
it to some degree. I
Yeah.
never have.
Mhm.
I'm
Yeah.
like, God, it'd just be nice to put that
Yep.
on there.
I will smash the French press. I like cable. Cable's my jam. And then yeah, marry the press down. Super boring. They're almost like obligatory.
Yeah.
Yeah, I agree with you. It's a great way to warm up the elbows. If you have elbow issues, I've got anything from bodybuilders to strongmen to powerlifters doing this. They're doing blood flow restriction, light banded press downs, and then they're doing their training session, and
Yep.
elbow pain's gone.
Yep.
So that is
Exactly.
a nice little hack.
Yeah.
Now, is it
Or
a band-aid?
biceps before
Yes.
triceps. There's that
Correct.
one
Yeah.
too.
And then yeah, goes without saying, I've done at least if my training, right, I'm back to upper lower with biceps and forearms being done on lower, but you better believe I'm doing 1 or 2 sets of curls before my tricep work, just to get
Always
that
a
in
good
there.
idea. And I
Yep.
did it the opposite for years and finally went, I'm just gonna try it this other way. I'm like, why have I not done this
Yeah.
sooner? Oh my God.
Yep.
All
Yeah,
right,
because you used to
tricep.
be, you got to do your compound first because I'm super, be as strong as possible. And
Sure.
then that's great for 5 years. And then your
When
elbows
you're
are like,
young,
hey,
yeah.
dumbass, like,
Yeah.
how about we flip flop?
When
Speaking of
everything's
which,
made
what
of
do you
rubber.
got for compounds?
Compounds, close grip bench press can be regular grip or overhand. Wait a minute, those are the
Mhm.
same damn things. What do you
Correct.
mean by
Yep. Just keep
Oh,
reading the
you're just
list.
saying either. Okay, I
Yep.
gotcha. I was
Mhm.
like, wait a minute, those are the same
Mhm.
thing. So close grip bench press, dips, or underhand barbell. Oh, I see what you're saying. Underhand
Mhm.
barbell Smith press. I like that.
Mhm.
Okay. All right.
Mhm. 'Cause
That's
some
why you
people
did that.
swear by the underhand, right? Like
Uh-huh.
Dusty and Dante, they're like, "That's the number 1 tricep builder."
Yeah. Okay. Where do you put them?
I'm definitely passing on the underhand, largely because of limitations physically with my wrist. Oh God. I love both dips and close grip bench. So I'm going to smash the close grip bench because that causes a little bit more issues for me currently and marry the dips, which would have been flip flopped. But I've done so much work on getting my elbows better that the shoulder's more limited than the elbows. So
Okay.
yeah, I mean, like a good old Vince Gironda dip, which I forgot we need to do a whole
I
episode
know.
about him.
It's coming up.
That was my favorite tricep builder. And
Okay.
like training clients would be like, that's Viagra for my chest, right? Because it's a great movement. But those days are long gone. So I have to do machine dips, but I've actually been able to start doing machine dips again. And God, that's such a good movement.
Okay. This one's a little harder because I don't do very many tricep compound exercises. I'm not a
Mm-hmm.
fan of them. So what I'm going to do is I'm going to smash the dips because I do like them consistently as a finisher when they are like hammer strength or whatever. And I use an odd grip. I use the no one. 1 out of 100 people will use this, if not less than that. I use the forward grip and showing the visual
Oh,
now. And
yeah.
people, yeah, if people be like, "What? I never wouldn't have thought of that." Number one, it's a finisher, so I'm okay. It's kind of cool because I don't have to load as many plates, but it hits my triceps harder and hits my chest less, I guess is a better way to put it. But it's just more comfortable on my shoulders that way.
Mm-hmm.
So I like it that way. That's the other two I have to kind of pick. It's a coin toss. But I'm gonna say I'm gonna marry the close grip bench press because there are times where I will finish a set of skull crushers and I'll be like, we'll get a few more reps here, and I will very deliberately and very controlled do, kind of a press and squeeze or an extension of a skull crusher set with close grip bench. But I am not going to load up. I haven't loaded up a close grip bench as a main exercise and used it for, trying to gain mass for years. I'm going to guess back to the DC days. I'd say probably almost 20 years if I'm being honest. And then I'm going to put the not the dips, the underhand barbell Smith press. I just never liked it. I
Mhm.
tried it several times early on. I came back to it, which is an important note. If you shelf any exercise and it's been years since you've done it, even if you hated it or it didn't feel right, always make a note to come back around just to try it out. And cruise weeks are the best time for this because you're
Mhm.
chilling, you kind of want to play with different exercises when you're not in there specifically to where you want to try to, use more weight or I want to say max out the weight, but the weight is more important and it's not during your cruise week. So play around with those exercises and potentially come back to them, see how they feel. Because there have been a couple exercises over the years that I have done that went, oh man, they feel great now. They didn't. Maybe it's because I haven't done them in a long time, or maybe it's just because structurally I'm somehow different. I have better range of motion in my shoulder joint or something, something that along that line. But I am definitely going to, just to reiterate, I'm going to smash the dips, marry the close grip bench, and I'm going to pass on the underhand. I'm not a fan of it at all. Personally, just me, preference.
Yeah, like it makes sense, but yeah, I think it fits like the palm weird. It's just
Yeah, it's
awkward.
just, yeah,
Yeah.
it is.
Yep.
That's the best way to explain it. It just doesn't feel
Mhm.
natural. It feels very forced and awkward.
Yep.
Yeah.
And then last but not least, and I tweaked it slightly because to make it challenging for
Right.
squats, a free barbell back squat, a
Okay.
free barbell front squat, or a Smith machine back squat.
Oh, okay. So you took do you say it Zerker or Zercher?
Zercher, yeah. I personally love Zerchers. The people don't think about them for bodybuilding, but I do think they're a novel stimulus. They get a lot of upper back. They're great for core strength.
Mhm.
Like you want to get a strong core and teach yourself how to brace to keep your ribs and your pelvis parallel, so not scissoring open. Zerchers are awesome, but how many bodybuilders even know what a Zercher is? Very
I know.
few. But I think they're super underrated. I think it's a great tool. And no, it's not going to be like your meat and potatoes, but do it for a training cycle and then go back. Your upper back's going to be significantly stronger. And I would argue, even though I hate the term bulletproofing, what's more representative of what we do in real life when we're lifting a couch? A
True.
Zercher, because we're not retracted, we're reaching forward. So you're strengthening your upper back in particular in the ways we typically use it, because all of our buddies are going to go, "You're big, come help me move."
Right. Which is
And that's when I tell them
exactly,
I'm all show, no go. So
yeah.
I'm not much help.
I gave up on moving things about 20 years ago when I was 35 because I realized I was more likely to injure myself
Mm-hmm.
helping someone move or moving my own stuff than even in the gym. And I'm like, yeah, I'm done with this. I pay
100%.
somebody to do it. I'm not doing it.
Yep.
Nope.
Yep.
Okay, so it's me, right?
Mm-hmm.
Okay, definitely back. I'm gonna go with the back squat first. Even though there is that vulnerability because of past back issues, it's still comfortable, natural, feels good until I start to really try to push and progress and push that poundage up like I used to when I was younger. Front squat, I'm gonna smash the back squat. Front squat, I'm gonna marry because I do know that if I'm in a gym with limited leg equipment, I know that the front squat on a Smith is gonna work well for me. So, okay, cool. I'll do it. I don't like to hold that bar. You know how there's two hand grips. There's the one where they cross their arms. Obviously, it's in front of my face. That's not what it is,
Mm-hmm.
but my microphone's in the way. I can't cross my arms and just rest. I can't do that. I literally have to hold it this way. I don't know what. Maybe it's because my shoulders are like this big. I have
Yeah,
no idea.
I was thinking maybe shoulders. Yeah. Yeah.
I cannot do that.
Okay.
So when I hold it in tight, it actually works, but it's just not. It's not a very comfortable. It's harder to breathe. I could breathe so much easier with a back squat, even if it was a lot of weight. But put that on my front, it's like I'm choking myself. It just doesn't work very well. But I can do it limited with weight and on a Smith machine if I'm in a jam, no problem. The Zer- you didn't say the Zercher.
No.
You said the
Smith
Smith
back.
squat.
Yeah.
Okay. Okay. Now I got to be super fast and go, okay, I'm going with the Smith. I have Zercher in front of me. I'm sorry. I didn't change that. So I'm going to go Smith is the smash because that's just, it keeps me in
Mm-hmm.
a fixed plane. It keeps me in a fixed path. far less vulnerability. Then I'm going to go back squat for, I'm going to marry that one. And the front squat, I'm going to get rid of.
I am not into erotic asphyxiation, so I'm gonna
Exactly.
pass on the front squat.
Very well
Like,
put.
yep, not my thing. I will marry the Smith back squat if I'm gonna squat, and I use a top squat attachment from Dave Draper. They're freaking awesome. And then I will smash a free back squat again using the top squat from Dave Draper. But yeah, so we actually we differed in probably like 60%. That's
Yeah.
pretty good for
Well,
us.
let's add one more. And even
Okay.
though it's like it's just a bit of a caveat. Zurcher squat, Jefferson squat, Trump squat, Obama squat. I put them all together and I just don't like them. And here's the thing, Marv, I see the functional component of it. I do. Like if I were to go in one day while I'm on, a holiday in Milwaukee and I just want to get a quick workout in that I get a good pump, I'm just moving blood, and it's a cruise week or whatever else. Okay. Things like that I'm totally cool with. But if it's a regular blast week, I'm not going anywhere near that stuff. And it's just my own preference. It's not that they're bad, but it's not isolative enough. It's just an odd, it's like with the B stance. When things are not symmetrical, I'm not good. My brain is too OCD for that. I can't create
And
that
I
gray
wonder,
area.
I'm built to be an endurance athlete, so I did a lot of running and played
And
soccer
functional.
and stuff. So like I'm a lot more comfortable unilaterally than
Right.
bilateral, and unilateral strength translates to bilateral. Bilateral does not to unilateral. And my unilateral strength is oftentimes the same, if not more than my bilateral, which is really weird, right? And that's even with the fact that some asshole surgeon cut out the majority of my teardrop, my vastus medialis. 60% of it was cut out when I was in the 6th grade by an a-hole surgeon. So it's really odd that I am super strong unilaterally.
Yeah, you can't go to surgeons with a Sally Struthers certification on the
No.
wall. You know better than that, Marv. But it
I
might have
know,
gotten
right?
you into the industry and might
Correct.
those
Yes.
things
So I
impacted
can't
you.
complain too much. The
Yeah.
chronic pain gets old, but I'm a hell of a lot better clinician because of that.
Right. And let me be, I just want to make very clear to close this out. Those exercises are great for core. I mean, you made a great point. I don't know if you saw the video, but I just saw it a couple days ago of the guy taking like 400 pounds and he took it off the rack and he set it sideways, like one end up and started moving it. And he got underneath it
Yeah.
and evenly pulled it
Yeah.
over.
Yeah. It's crazy when people can do that. Yeah.
I'm like, oh my God, like that is about as functional. Like, holy crap, your core is just,
Yep.
dude, it's rock solid. Like, I want a lower back, like, and obliques like that. I wouldn't have, he's got zero back pain ever if he can continue to, maybe not at that weight, but the point is just that exercise alone, it's so beneficial for longevity and lower back and oblique and torso health that it's just, oh man, it's like I should be doing more of that from that standpoint. But we're meatheads. We look at it and go, I can get more out of squats. I can get more out, for size. And that's where we're not in this for the functional part. It's a great idea, but the vast majority of us are going to be like, eh.
That's why I'm so headstrong on all of my programming. You got a hit cardio day with non-traditional core movements, doing stuff like that. So if you want to start doing that, you're not going to load a barbell. You're simply going to put an empty bar on your back and start side bending and then start making one side a little bit longer, right? I mean, it's an empty bar when it's totally off to the side. Bending is brutal. Don't start there, especially if you haven't bent laterally under load. Right? Unless you live in Houston and then book an appointment ahead of time, which hopefully we don't have to deal with. But start getting into different ranges of motion under load safely and controllably, and then do what Skip does and quit helping people move.
Exactly.
Yeah.
Furniture's one thing, but a tanner, don't ever move a tanner. And when the gym owner asks you if you'll help him move equipment, don't do it. I have all these gems. I'm old and I'm wise. So if you need more help, I'm your guy. On that note, I think it's time for Marv's Rehab, Prehab, Rodeo Roundup. Woohoo!
Yes, sir.
Love it.
All right.
What do
This
you
is
have?
actually a question from Jeremy Hosey, and
Okay.
I don't know if I said his last name right or not, but he said, can we get an episode on sciatic nerve pain, things to do to assess it, exercise to counteract it?
Okay.
So figured this is a big one that lifters deal with quite a bit. I will say most people who come into my office, because remember, I am a performance chiropractor in the Houston Bay area. Most people say they have sciatica. They don't. But that's the term that everybody, I have low back pain. It's sciatica. So let me pull up my screen real quickly and show the anatomy.
And while you're doing that, when you truly have sciatica,
You
you
will
will know the difference.
Yep. It is pain radiating down your glute, down your leg, following the sciatic nerve distribution, which is your largest nerve. And the true sciatica is pain is below your knee. If you have pain that's only in your glute, it's most likely coming from your lumbar spine. There's a trigger point, might be an SI, but true sciatica is there. So that nerve root is the largest in your body. It comes from your L4 to S1 nerve roots. And so, and a very important muscle though, okay, so let me backtrack. 85% of sciatica have disc issues, right? Usually L4, L5, L5, S1. 13 to 40% of people will have it in their lifetime. Why bodybuilders might have a little bit more is, heavy lifting, right? Occupational stuff. If you already have a disc and you're doing a bunch of, heavy loading, so squats, deads, bent over rows, I will say anecdotally, deadlifts or bent over rows on a warm up set. I did my warm up set. I set the bar down. That's when I felt and heard the pop. That is a very, very common thing. So here's your sciatic nerve, right? It runs below your piriformis muscle or pierces the actual muscle belly in 12% of people.
Really?
And this, I will say, I don't always go, you got symptoms in your legs. I don't go, oh, it's true sciatica. We got to do an exam. So you've got to do an exam because I can't tell you how many times I have sciatica. They come in, it's piriformis syndrome. I like dry needling this. There's a couple special adjustments you could do, get that to release with like a figure 4, a pigeon stretch, a 90-90, and there's pain-free within a day. But that's your sciatic nerve. That is a big honker. It comes all the way down the back of the leg. I wonder if I get rid of the musculature. Yep. So boom,
there we go.
and then it starts to branch out and then it goes down, blah, blah, blah. Right. But that right here, the pink,
Where does it
that is your
end?
sciatic nerve. Kind of like around mid thigh. And then you've got this nerve, your common fibular, common peroneal. It's a very short nerve that wraps around your bone down here. And then they go into different branches. But your
Okay.
sciatic nerve is this big honking guy right there.
Okay.
And it's coming from all these different nerve roots. Okay. Now, less than half of people will develop actual muscle weakness. Now, really bad cases is foot drop. Like, it's, oh, man, feel so bad for the guy. He's 31 years old, dead foot. I mean, slap, slap, slap. Had to relearn how to walk. People also have glute weakness. So usually there's sharp aching pain going below the knee. Like I said, L5, S1, L4, L5 are the most common. On screen is the pain distribution pattern. They differ slightly, but there is some overlap, but that's on the screen right now. Now, big signs is increasing pressure via Valsalva. So whether you're sitting on the toilet straining, coughing, sneezing, bearing down, if that lights up symptoms down your leg, there's a good chance you have that. Again, you might have some foot strength. Really severe cases, your reflexes will diminish, and then you're going to have pain in a certain pattern. So to be properly diagnosed, somebody's doing muscle testing, sensory testing, and your deep tendon reflexes, right? Like when we're a kid, smacking the knee, blah, blah, blah. The most common cause, like I said, is disc herniation with an inflammatory response, right? It's pressing on the nerve root, inflammation picks up, that gets worse. That's why like corticosteroids like prednisone will clear it up in people pretty quickly. I didn't really see any like delineation in the research of piriformis syndrome in like athletes versus gen pop. But like, again, you've got to make sure you're getting a proper workup because just because you've got pain in your foot, it could be coming from your piriformis. But disc, I'm going to go on a little bit on a soapbox. Imaging is a piece of the puzzle. It's not the whole puzzle. I actually advise against imaging the second you have this, because the research is very clear. People who get imaging early on at the onset of low back pain and pain going down their legs, they have worse outcomes across the board. Their pain scales are higher, their chronicity is higher, the amount of money they spend. If you get an MRI day one of having symptoms, you're 13 times more likely to go through surgery than not. So
Oh,
I would recommend, so long as you could tolerate it, trialing conservative care. But say you get imaging, you're going to find something. So let me read off some stats. These are people who have these imaging findings that do not have pain. So I've said on here before, imaging is a piece of the puzzle. I could have somebody with a pristine, clean MRI and they are crying in agony. And I can have an MRI where I'm like, how are you breathing? And they're
yeah.
in no pain. So disc degeneration on imaging with no pain, 37% of people in their 20s, 52% in their 30s. 68% in your 40s, 80% in your 50s.
Wow.
Okay. Disc bulges on imaging, no pain. 30% of 20s, 40% of 30, 50% of 40, 60% of 50s. And then disc herniations or protrusions, 29% of people in their 20s, 31% of their 30s, 33% of their 40s, 36% of their 50s. So you most likely, if you get imaging, they're going to find stuff, especially clanging and banging in the gym long term, right? That's going to happen. But your disc will get significantly stronger and thicker, right, as we load stuff up. So it is very protective. Again, conservative care for the first 4 to 8 weeks. Typical guidelines say 6 to 8. I'll kind of see how people are doing. Most cases kind of resolve on their own. If you have the worst disc injury possible for a piece of the disc, so even though it's not a great analogy, they say it's a jelly-filled donut. It's not a great analogy, but we'll stick with that. That actually goes all the way through and it's floating in your spinal canal. Your body will spontaneously heal itself. It's either 94 or 96% of the time,
Oh,
right? It's
nice.
remarkable. The worse the disc injury, yes, your pain sucks, but the duration is usually lessened because your body heals itself. Our ancestors didn't have doctors. If our body couldn't heal itself,
Right.
like we would not be sitting on here talking awesome bodybuilding minutia because the
Right.
human race would have died off, right? So, um, staying active is your friend. Motion is lotion. This is one time where I go, NSAIDs could be our friend. Just follow guidelines, right? Go from there. Now, there's some things you could do exercise wise. So there's something called McKenzie where you're lying face down and you're pressing up. So a prone press up, and you're trying to get something called centralization. So here's how to know if this could help. Because if this is you, majority of disc bulges, herniations are to the backside. It's very rare to be on the front. So this is a way to kind of suck it back in, which is awesome. Say you've got radiating pain and it's down in your big toe. And you lie face down and you press up. That pain now travels up and only originates in your calf. That has centralized. It's gone closer to midline. That is a great position for you. That's your position of relief. You're going to get in it multiple times, oftentimes doing reps, and you could suck it back in. Now, say you've got pain that goes just in your calf, okay, just on your big toe and your calf, and you do the prone press up. The pain lessens, but it now travels down to your big toe. That is not the position you want. It is where does the pain travel? So that could be super helpful. Something called nerve flossing from neurodynamics. You're moving the piece of floss like a piece of dental floss, trying to loosen it up. That is your big picture. You're going to be doing that multiple times per day. Getting the piriformis to relax. So your figure four, if it's really bad, people are not going to want to get on the ground and do a 90-90 or a pigeon stretch.
Right.
There's some other ways to release your piriformis. And then getting the low back to calm down. Your cat cows, your bird dogs, super freaking boring. But if you've got a case of an acute low back pain, cat cows, legs only bird dogs, figure four stretches, play around with the press up positions, play around with nerve flossing. That's what you're going to want to do.
Why only legs for the bird dog?
I just find because I want you so focused on having good control and bracing. People do the arm, and most people don't do bird dogs correctly. They're just haphazardly. Like to do a bird dog correctly, imagine you've got a scalding hot bowl of soup on your low back and you cannot let that spill. like I'll put a weighted ball in office, and most people, they can't keep it still, right?
Oh,
So that's on screen right now. That's what I'll do to teach it. It's actually a really good way to teach people how to do a bird dog, right? Is can you balance something on your low back while doing that? So I just simplify it and go in there. And then like in office, I'm a big fan of dry needling. Careful adjustments might help, might make it worse. So it all depends.
mhm.
You got to know what you're doing. You got to be very careful. Manual therapy could help. But again, motion is lotion and hydrating. This blew my mind is a colleague sent me 2 MRIs. One looked like the back of an 80-year-old. Now, I've gone on a rant before when most people say, "Oh, my ortho said I have the knee of an 80-year-old." That's a sales tactic. They're going to tell every single person who walks in their door that day.
Yeah.
But this legit loss of disc height, the discs should be not white, but brightly visible. The discs were desiccated, they were dark, collapsed, blah, blah, blah. And then it was like, this is the same patient. I was like, what? The second one, disc height improved. The discs were nice and plump. Same person, he's in his 20s. All he did was he was chronically dehydrated, like less than 30 ounces of fluid a day. I was like, that's
Oh,
weird.
man.
Like,
Yeah.
what are you doing with your life? But whatever.
Yeah.
He started hydrating. His disc height returned. His sciatica gone. So like hydration is massive. Also, you need to flush out all that inflammation. So there's that. But again, if you try and do conservative care and it's not working, or you're in so much agony where you have to do, an epidural, you have to do an oral corticosteroid, don't do what most people do. They get the shot, it calms the inflammation down, they feel better, and they go about their life. No, no, no. You do those medications to then be able to rehab the issue.
Okay.
If you get a shot, if you get cortisone, you have to rehab because you only get so many in your lifetime or it's going to degenerate the joint.
Right.
Surgery in the research, so disectomy, or they're cutting out. Short term, beneficial, long term does not outperform conservative care. So again, we will try to, exhaust conservative care. In the last year, I've had 3 patients have to get surgery, and it was awesome for all of them. But that's 3 out of 50 or 60 people that have come to me with like legit sciatica. But again, most people don't have it. And then again, I'm not going to do imaging unless if there's no yellow or red flags, if I feel pretty confident it's coming from a disc. I still don't like imaging of what I talked about. But if you have to, you have to. And then once, more than half of people are still going to have recurrent pain at 6 months. So again, that's people who didn't fix the problem. Can your hips move, especially internal rotation? Do you know how to breathe or brace? Are you hydrating? What is your exercise order, right? We talked about smart exercise order earlier on. So be smart. And then also get your core strong in more directions than just flexion and extension.
Right.
That's going to be one. And then, just know that it's super common. It could be absolutely debilitating. Skip has shared his stories that it could be that bad. And so, yeah, in that case, I'm not going to go, oh, suck it up for 6 weeks. No, but that is the exception, not the rule. But just be cautious of getting imaging and pharmaceuticals day one because the chronicity and the outcomes is wacky, wacky. And that is sciatica 101 in hopefully 10 minutes or less.
Very nice. On that note, I think it's time for my cheat meal review. Kind
Mhm.
of cheat meal review. It's a little bit outside of the box for this one, but that's okay.
You're getting a little
I
loose with the definition, but
exactly, but
but
everybody
it's
can relate.
mandatory. Yes.
Yeah,
Oh,
e
absolutely.
everybody
I'm
can
very
relate.
curious. I'm very curious.
So, what I'm doing is I am rating my top 5 Monster Zero flavors to see if anybody agrees. And I'll probably get trashed in the comment section. I usually do. That's okay. But the last show I did number 5 and number 4. Number 5 is Wild Passion. That's the new light purple one. It's only been out since what, mid-November. So a lot of
Mm.
you probably haven't had the opportunity to try it. I have, and it is very good. Now I admit that sometimes when a new flavor comes, I'm like, oh, this is the best flavor I've ever had. And then a month later, I'm like, yeah, I'm sick of it. But this one is pretty good. And I'm a big fan of the lighter ones. I don't like the heavier flavored Like this one is a light blue. The original purple is still there, and I always liked it, and I like it on occasion, but it's heavy. A lot of flavor there. It just tastes heavy. Number 4, Vice Guava. That's the teal and pink can, has the Miami theme.
Mm-hmm.
Pretty good. So number 3 and number 2. Number 3 is the Fiesta Mango. It's a teal can. You're not, well, at least here in South Florida, I typically can't find it in the grocery stores. I got to get it from a gas station. So then you're paying like, I don't know, $3 a can. But when you want something, right? That's how I buy my watches. Anyway, that's another rabbit
Time
hole.
pieces.
Time
Time pieces.
Exactly. Thank
Yeah,
you. That's
see,
right.
I learn. I
Time
pay
pieces.
attention. I pay attention.
Number 2, Fantasy Ruby Red. That one hasn't been out for it's been out, I think, a couple years. Pink and light blue can. It's like a pink.
Oh, I've had that.
Yeah,
Mhm.
it's a good one. It's a good one. Not going to give away number 1. I want to hear in the comment sections what you guys think is your number 1 and what you think mine is. You might think it's obvious. Maybe it is, but maybe it's not. Maybe it's a new one. I don't know. Next show.
Nice.
You got any questions over there, Marv? How are we doing on time?
Yes. Yep. I think we can knock out at
Yay.
least 1, maybe 2, because they're pretty quick conversations. So
Sounds good.
and then listeners, we need good questions, please. So please type away. At Mark's Cram, just discovered somersault squats. Any opinion on them? Seems to use as a finisher.
Well, you know my take. I'm going to reiterate it, though.
Mhm.
I do think it's a good exercise if you have a garage gym or you're on vacation. So my position on it is a little bit different than yours, Marv. I think you like them more than I do. It's not a bad exercise. I'm just like, I could find a piece of equipment that will work equally as good. But if I'm in a jam, then I certainly would use them. But it's not my go-to. It's not a go-to quad move for me.
Okay. It's essentially a closed chain, foot on the ground version of a leg extension. So open chain, your foot's in space, closed chain, your foot's on the ground. There is going to be difference. Let me explain the differences of why I now feel about them differently than skip. Open chain is going to have a lot more shearing force on the ACL, especially near full extension, right? So 0 to 40 degrees, that top. I can't do heavy leg extensions, which makes me sad because I hear about people talking about just insanity on the leg extension. I'm like, God, I wish I could do that. Closed chain will create a lot more shearing force on the PCL, especially as the knee's bent. So think like 85 to 105 degrees of knee flexion, you're going to load the PCL. Closed chain, foot on the ground, no big surprise, has a lot more compressive forces of your shin and thigh bone. And as a result, it's going to have a lot more muscle co-contraction, meaning your quads, your gastroc, and your hamstrings are going to be firing more to create more knee stability. So with my knee history, I've never been able to do heavy leg extensions. I could do BFR, 50 pounds most, and even then, So I love them. Belt squat's my favorite variation. My leg day last week, it was my 3rd leg day back. I supersetted heavy 100-pound somersaults with hack squats with a 45-second rest in between, just to pretty much put my belt on and reset the song. And that's murder, right? Like, good God. Somersaults and hack squats, you do 2 to 3 rounds, you're barely going to be able to walk. So I'm a huge fan of them. Yes, if you're a garage gym person, you're probably going to have to do them for variety. But if you're a gym person, give it a shot. Yes, you could do it on a Smith machine. That's how I originally learned it from Dr. Scott Stevenson, who learned it from Joe Daniels. He now does kettlebells, which I really like. If they're heavy enough kettlebells, now I just do a dumbbell, or the belt squat is perfect.
Cool.
And then one real quick fun one. It's just interesting from Fugate Official. What do you think of doing time sets? I remember hearing Louis Simmons and Dave Tate using them on accessory movements for powerlifting. I've been experimenting doing time sets on the leg presses with only 2 rules. First, the set has to last 60 to 90 seconds. And 2, you can't lock out. So a 10-second negative, pausing at the bottom, explosive reps. It's all fair game so long as the set lasts for the set amount of time. I wasn't sure if this is an actual training method or if there's a better way to do it.
Well, I'll say that I haven't done it,
Mm-hmm.
but I don't think it's a bad idea because it's a completely different stimulus. You're coming at the set completely differently.
Yes.
So, and I think it's important to note that I believe it was Dr. Serrano, but I could be wrong. I'm 85%, 90% confident with this that it was Dr. Serrano who said that time under tension becomes the most effective or the most optimal at the 45-second mark.
Mm-hmm.
Have you heard similar?
Yeah. So, like, it seems like 45 is awesome. I believe that was the whole thing behind MI40 with Ben Pokulski for the
Okay.
40 seconds, right? So, um, there's no, and then in the data off the top of my head, negatives anywhere from 2 to 8 seconds seem to be optimal. So he's doing 10 seconds. That's might be a little slow, brutal, like a great finisher. Good God. Like
Yeah.
I just picture this person setting a timer and closing their eyes and just trying to feel that quad through every inch of the range of motion. That's
Yep.
got to be pretty damn intense.
And it's funny because I think about that with legs and I think about the time under tension of most of my sets, say like a belt squat or something like that, a pendulum.
Mhm.
I'm going to spend more time under tension on a leg movement. And oddly, and I don't even know how I noticed this over 41 years of training, but I probably noticed it within the last 6 months. I'm like, the shortest amount of time under tension for me of any of the muscle groups I train would probably be back. So in noticing that and having that awareness, I thought this next year that's gonna be a focus of mine. I'm not like a New Year's resolution guy, but
Mhm.
just because of the timing of me coming to that conclusion, I'm like, that's gonna be my focus, after the first year. I'm gonna try to find ways to increase that time under tension for back because it's noticeably less than other muscle groups. And without me counting it I just know
Mhm.
I'm like, wow, that just didn't seem like a very long set. So
Metronome.
this is something that I might actually give a give a
Mhm.
give it an opportunity and see. It's not something typical that I would do because I am more focused on, I don't want to say the poundage, but using that higher level of resistance and I'm focused on failure. I'm focused on
Mhm.
getting to that failure mark and just feeling the muscle work. But to notice, and that's probably why I didn't notice that time under tension being so different because I asked myself, like, that's probably been that way for a while. Wait a minute, my back could be better. So it's like,
Yeah, and I like that you're not counting reps because even though
sure.
you tell yourself no, as those rep numbers start counting in your head, we all know what happens. We could deny and say it doesn't. Like, that's why I will always go aim for a higher rep number and say out loud, like, your target should be a higher rep number than you know you're gonna get. That
Yeah.
way you're pushing. Because if you
Mhm.
say 12 reps, you're great on rep 10, and all of a sudden rep 11 gets way heavy. But if you
Yeah.
had said 15 reps, I bet you could get to rep 12 or 13 before it starts getting heavy.
Yeah.
It's just
And
human
that's the
psychology.
psychological
Yep,
component of it
correct.
that plays into everything we do. The mind will not go,
Mhm.
or the body will not go where the mind has not already been.
Yep.
Sounds cliche, but it makes a very, very solid, very valid point.
Yep.
Agreed. Agreed. But it's on my brain. So I think it's a great question, but I just can't say that I've ever done it before, but it has me the timing is good.
There was a one prep coach guy who used to do that. I can't remember.
Yeah, I can't
I
think
don't
of
wanna
it.
say the wrong name. I think
Yeah.
I remember, but if I said I don't wanna people be like, "What the hell?" So,
Yeah. Wasn't him,
yep,
it was him. What a
yep,
dumbass.
correct.
Fair enough. Fair enough. I think on that note, is it time?
It's time.
We got to get to getting. This is Skip, Dr. Marv Splitting. If you enjoyed the show, be sure to like, subscribe, share, and ring the bell. Hit the hype button. I don't know if it makes a noise, but the other buttons will make it sound similar to this. And if you didn't like the show, pretend you did. Like, subscribe, share, ring the bell anyway. Use the truenutrition.com link to save 10% on not just Team Skip protein, but every supplement they sell. You can reach out to Dr. Marv at theeducatedmeathead.com, and you can reach out to me at teamskip.com. If you enjoyed the episode, be sure to click on this link for another episode of Between Two Dumbbells.